Good morning, Candace.
Hi, Dr. Ojile. How are you?
I'm doing great. And you?
Doing well, thanks. Great to be with you this morning.
Thank you, and thanks for having me. I appreciate it.
Of course. Why is sleep so important, and why do so many people have trouble falling asleep at night?
As you know, Candace, sleep is important for every function of our daytime life and our health. So we need sleep to live. We need sleep. If we don't have enough sleep, we can't think correctly. We're irritable, high rates of depression, so it affects our day-to-day relationships, and it affects our health as far as things like blood pressure, heart disease, diabetes. So all three components of our life. Increasing sleep difficulties are being seen now more and more likely because of our 24/7 society. People are awake all the time from the standpoint of doing different activities, work, socializing, and shift work, increased stress, and increased technology in the bedroom. So smartphones, computers, and TVs are very disruptive to sleep. So those are three big areas that we see.
And is it true that more women are more likely to be, to have insomnia than men?
Women appear to be a higher risk for insomnia, not exclusively, but slightly higher risk. And women are just slightly less at risk for obstructive sleep apnea, although the numbers are quite close.
And what is the difference between occasional sleeplessness and something like insomnia?
So insomnia is difficulty initiating sleep or staying asleep or having restful sleep with restorative sleep with a daytime consequence. And chronic insomnia typically occurs 14 nights per month or more. Whereas occasional sleeplessness is just that occasional, every now and then, once a week, once a month difficulty getting to sleep for a variety of reasons, which could be stress, travel, or some work issue or staying out socially.
And we're all guilty of watching TV in bed. Is it true that it can help you wind down and fall asleep?
Well, that is one of those sleep myths that we want to dispel a little bit, which is that watching TV, if that's how you want to wind down, is okay, but you shouldn't watch TV in bed, and preferably not even in your bedroom.
And we've all heard how, you don't want to exercise too close to bedtime because it can keep you up. Is that true?
Yes, exercise is good. We're for exercise, and it helps with sleep and a variety of other health issues, as you're aware. But you want to keep the exercise 3 to 4 hours distant or away from the bedtime, so that your body has a chance to cool, your heart rate and other bodily functions are quieting down as you ease into sleep.
And if you're having trouble sleeping, should you get out of bed or should you just stay there?
No, if you're having trouble sleeping 15 or 20 minutes and you can't get to sleep, it's good to get out of bed, either meditate, relax, read something in a dim light that's relaxing, and as you start getting sleepy again, then you can get back in bed and try to go to sleep.
And are there any simple over-the-counter sleep aids we can take to help reduce the amount of time it takes us to fall asleep so we can wake up refreshed?
Yeah, there are, and there's been a new one released this week called ZQuil, which is a new preparation of an old medication, diphenhydramine, which is an antihistamine developed in 1946. It's been put into a liquid form, so it's easy for folks to take, and that liquid has kind of a warming sensation to it when people take it. And this is something that could be used on an occasional basis that they could have in their medicine closet or pick up at the drugstore.
And are over-the-counter sleep aids safe for everyone to use?
Well, they're safe for folks to use. They should be coordinated to make sure they don't have any interactions with their other medications or untoward side effects. But otherwise, they've been around for many, many years and should be safe.
And what should we keep in mind when we're looking for the right sleep aid?
Well, part of it is having a coordinated attempt at sleep health. So doing the things that we've talked about, fixing your wake time and bedtime, avoiding some of the things you've already talked about as far as technology, doing exercise at the right time. By the way, avoiding alcohol and caffeine prior to bedtime. And then if you need either an occasional sleep aid, it's fine to use that. And if you need something chronically, you want to talk to your physician about more chronic therapy.
And when it comes to food, what should we avoid and what should we eat if we're looking to sleep better?
So avoid a heavy meal right before bedtime. And if you're going to eat a snack, you'd want to lean more toward a low sugar, low carb snack at bedtime is better, and certainly nothing with caffeine like chocolate right at bedtime.
Do you have any additional tips or information you'd like to share?
Well, I just want to encourage folks to include sleep in their total health plan, to continue to work on diet and exercise, and healthy sleep can make both of those activities and their health plan more effective.
And where can we go for more information?
The two websites, sleepfoundation.org and zquill.com, both contain information for your viewers.
Thank you so much, Doctor. Have a great afternoon.
Thank you for your time.
Thank you. Bye-bye.
Bye now.